For flexion, I begin lifting my patient's leg while supporting the lower leg. I then ask my client to resist my strength into extension. I give her a countdown of 3, 2, 1 so she is ready. For extension, I begin by lifting my patient's leg and placing one hand on the inside of the upper thigh. Before I do this, I ask the client if it is okay to place my hand here. My other hand will then support the lower leg. I ask my client to resist my movement into flexion. I give her a countdown before I apply the resistance so she is prepared. For adduction, I start by picking up my patient's leg and placing one hand on the inside of the patient's lower leg and my other hand placed on the inside of their upper leg. Before I do this, I ask her if my hand is in a comfortable position. I then apply resistance and tell my patient to try and push her legs back together. For abduction, I pick up my client's leg and place one hand underneath her lower leg and one hand on the outer part of her upper thigh near the greater trochanter. I ask my patient to push her leg outward into my hand as I apply resistance. While doing all of these tests, I am consciously asking if she feels any pain at all. For external rotation, I begin by placing my patient's leg in 90 degrees of flexion with one hand on the inside of the patient's lower leg and one hand slightly on the inner thigh. I will then ask her to move her ankle inwards while I apply resistance in the opposite direction. For internal rotation, I hold the patient's leg in 90 degrees of flexion, one hand just above the patient's knee and one hand on their lower leg. I then ask my client to move her ankle outwards while I apply resistance. I then begin my integrity tests. The first integrity test is the fader test. This test is done to assess the integrity of the muscles at the hip. To start with, I flex the hip into 90 degrees of flexion. I then adduct and internally rotate the hip. This contracts the iliacus, the pectineus, the psoas, and the rectus femoris. This is a positive test if there is a reproduction of pain. This test will also be done to determine whether there is a femoral acetabular impingement syndrome, an anterior labral tear, or iliopsoas tendinitis. The next test is the Faber's test. To begin with, I lift my patient's leg and inform her I'm going to place her leg into a figure 4 position. The hip is flexed and abducted, with the lateral ankle resting on the contralateral thigh, proximal to the knee. When doing this, I make sure my patient's ankle is able to move freely. I then fixate the opposite iliac crest. I then place my other hand on the patient's knee and apply a light force. This test is done to test the integrity of the labrium or arthritis at the hip joint. This can also be done to determine if there is a non-specific hip pathology or a change in range of motion. I start this test by placing my patient's leg into flexion and adduction. I then apply a light force and this is maintained throughout the test. One hand is on the sole of my patient's foot and one is around her knee, either on top or under the knee joint. I take the hip joint through full range of motion by taking the knee to the nearest elbow, following it to the shoulder on the same side, the opposite shoulder, and then the opposite elbow. This test is done to ensure that the hip goes through full range of motion. This test is positive if there is any pain or pain becomes worse during this movement. Following on from this test, the Scour test is then completed, which is an adaptation to the hip quadrant test, as it tests for the same issues. Instead of stopping at the 4 quadrants, I moved the joint in a fluid motion, making sure that the hip was going through the full range of motion, always starting with the unaffected leg first. Once the integrity tests have been completed, I then begin with the muscle tests. The first muscle test is the Trendelenburg test. To begin with, I ask my patient to stand on one leg for around 30 seconds to see if any pain is produced. I am also looking for a raise in the hips, one side may be higher than the other. I then ask the patient to do the same, however this time I ask my patient if I can place my hand on the posterior superior iliac spine, and I then ask the patient to complete this test again. This time I can visually see if my thumbs move when she lifts her leg. This test is done to identify if the patient has a weakness in her hip abductors. This test is a positive test if the pelvis drops towards the unsupported side. This test measures the hip flexor length and can determine if there is tightness between the joints or iliopsoas tightness. I begin this test by asking my patient to stand at the end of the bed. I explain that she needs to pull her leg towards her chest and lie back on the bed. I then observe and see if the leg that is supposed to be relaxed is tense or if there is tightness at the hip joint. I then ask the patient if she can feel a stretch in the hip or groin area. The last test that is done is a functional test. This is just a simple squat.